Hi, I'm Janine. I'm an Australian registered nurse with Masters in Global Health Policy at London School of Hygiene and Tropical Medicine. We recently relocated to the south of France where we are living. I want to give you an update on the situation I find myself in regard to COVID-19. Here in France, we've been in lockdown for 5 days. All non-essential business is closed. People are expected to work from home. All the restaurants are closed. All the beaches and public areas are also closed. The army and the police have been enacted to ensure people stay at home and there is a curfew. Drones have been deployed with loudspeakers to get people off the street and to stay indoors. You are required written permission to shop for groceries or to leave the house. Effectively, this is a lockdown. The area I live has been declared a hotspot as the cases of COVID-19 are increasing significantly. The hospitals are full and the testing is limited. Unless you have respiratory distress, you are not admitted to hospital and people are naturally scared. People with symptoms who can manage are asked to stay at home and to isolate. As a member of the English-speaking Facebook group for my area, I found there was little support for this group of people who exhibit symptoms, are scared and unable to get medical advice or care, even though they are frightened and sick. So I have been offering nursing advice to various symptomatic people in my Facebook group, checking in with them to see they are okay. On private message, I first ask for a short medical history, their age, and determine their symptoms. Then over the next few days, I check in with them and encourage them to check in with me and to ensure that they are on the mend. Without any medical intervention, the ones I've spoken to are recovering with rest, isolation and support. Mostly, they are symptomatic with cough, diarrhea, fever and a sore throat. None of them have had underlying medical conditions or are older than 70 years old. The anxiety levels, however, remain high. They are concerned they are not getting tested and they are not getting medical attention. However, the hospitals will soon be overwhelmed with people who are effectively not so sick. So I encourage them to go going to hospital where the very sick people are would be ill-advised. Hospitals are full of infections, both new and established. The kind of advice that I offer is some medical first aid, encouraging hydration, regular temperature taking, monitoring their symptoms and encouraging isolation. It would be great to see if that this sort of community nursing service could be started in your area. It's important to keep those we can out of hospital, but to ensure they feel supported and have someone checking in to ensure their condition does not deteriorate in their isolated states. Thanks very much.